Hello everyone. I am delighted to be among you today in order to discuss a fascinating subject, the stem cell secretome. It stands apart from conventional skincare as it has the capacity to rejuvenate, to regenerate, and to reverse the sign of aging. I will not talk commerce, and I will not advertise for secretome. I will focus on the science and the mechanism of action behind the therapeutic effect of the secretome. Today, throughout our session, we will unravel the science behind the magic. So, hopefully someone can help me. So, sorry for that. So cell-free therapy or stem cell therapy, are they alike? So since the discovery of stem cell therapy, and researchers all over the world were interested to study their use in many conditions and many diseases. The hair loss, wound healing, cardiovascular diseases, Alzheimer, Parkinson, macular degeneration, diabetes, and so on. And we heard and we hear a lot of stories about stem cells in the news. So we have the first FDA approval for ALS treatment in Michigan. Then we have the type 1 diabetes that is cured and in his phase 1 and phase 2 for the stem cell therapy. Again, diabetes in US, in Europe. Then we have the California Institute for Stem Cell Therapy that have funded the trial for retinitis pigmentosa, which is a degenerative disease that causes blindness. Then we have the stem cell therapy to restore erectile dysfunction and sexual function. Then بالفيديو لبنانية تستعيد بصرها إثر أول جراحة من نوعها في العالم. خلايا جذعية فانوسك السحري. The FDA approval for the therapy of Duchenne syndrome in also in the United States. Then diabetes again. الخلايا الجذعية لمحو تجاعيد السنين مونte كارلو. Then Harvard Medical School, the stem cell and the end of aging, then the paralyzed man who will regain his hands, the use of arms and hand after experimental stem cell therapy, also in Los Angeles, California. Then the rescue of the career of the Australian football player Adam Goodes, who regained his function of his joint after the stem cell therapy or injection of the stem cell in his knee. Have we really discovered the fountain of youth? Can we really reverse our age? Are stem cell the elixir of life? And why stem cell? Because stem cell is different from all other cells in our body. So they can self-renew and also they can differentiate. What do we mean by differentiate? It means they can become bone, cartilage, muscle, marrow, hair, liver, eye, skin. So that's what it means they can differentiate. But how come that one cell, the same cell, can go and arise in different lineage? It's because of the environment. The environment dictates the fate of the cell. So it is the environment that tells the cells, well, now you have to go and make keratinocyte. And now you have to go and make cartilage. So this environment is very important because this is what we are going to talk about the secretome. So the secretome is the environment. Not only this, but stem cells have what we call the plasticity. What do we mean by plasticity? It means they can go and be induced from one lineage to the other. It means that if I take cell from the adipose tissue, they can adapt and generate skin cell, even if the origin is not skin. And this is what we call plasticity. So mesenchymal stem cell do more than respond to stimuli and differentiate. They are responsible for turnover and maintenance. They are the reservoir in our body. They are present in order to repair any injured or damaged tissue. They have the capacity to migrate. They go from one place to the other, like the white blood cells. They are the only cells capable of going from one place to the other. So they migrate to the site of injury in order to repair. This is here, we have an injured liver, so we have to repair it, because they are smart cells and they have the capacity. And again, it is the environment that leads the cell to the site of injury in order to repair. But not only this, they have other also characteristic. They secrete bioactive factor, and that's what we call the paracrine effect of the stem cell. So those paracrine and bioactive factor, they have function in the immune system. Not only this, also they are trophic. What do we mean by trophic? Trophic, it means that they stimulate the cell in the vicinity, the neighbor cells, and tell them, well, you know, now we have to fight inflammation. Can you help me and secrete also anti-inflammatory cytokines? Oh, now we have fibrosis. Can you secrete, please, anti-fibrotic cytokines? So we have a multiple effect, and we have a potentialization of the effect, because we have the bioactive factor that are secreted by stem cell themselves, and then we have the trophic effect, that the stimulus of the neighboring cells to secrete also bioactive factor. So this is the mesenchymal stem cell here, and we have the growth factor that is secreted, the cytokine, we have the proteins, the fibronectin, the hyaluronic acid, the collagen, among other, and we have what is interesting for you all, because you are hearing a lot about it, the extracellular vesicle. The extracellular vesicles are the exosome and the microvesicles. So we have 2 extracellular vesicles and 3, because we have also apoptotic body. So we have the microvesicles and the exosome that are going to communicate information to target cells in order, and they are formed of proteins, lipid, DNA, microRNA, and RNA, and they influence the therapeutic efficiency of the secretome. And before going, we have to say that they are anti-fibrotic. Those secretions are anti-fibrotic, anti-inflammatory, anti-apoptotic, against pain, etc. Cell-free therapy means without cells. We don't inject cells. We are only using the secretion of stem cell. So secretome or exosome are the cell-free therapy. But before, what are the type and sources of stem cell? So we have the embryonic stem cell, we have the induced pluripotent stem cell, and we have the adult tissue stem cell. Because the embryonic and induced pluripotent cells have ethical and religious issues using them, so we don't use them, and they can be proliferated without control, so they can cause cancer. Therefore, we use only adult stem cell. So where we find the adult stem cell? We find them in all tissues, in the brain, in the eye, in the breast, in the muscle, in the intestine, in the skin, in the testicle, in bone marrow, etc. But the most commonly used sources of mesenchymal stem cell are the bone marrow, the adipose tissues, and the neonatal tissues. We call umbilical cord neonatal tissues because the adipose tissues and the bone marrow are adult donor. They are from adult donor. However, the umbilical cord are obtained from neonate. What are the differences? So the bone marrow are mostly used. ليش بيستعمل أكثر شيء استعملوا البون مارو؟ لأنه أول ما اكتشفوا الخلية الجذعية اكتشفوها بالبون مارو. So therefore all the research were done on the bone marrow mesenchymal stem cell. It is invasive procedure in order to contract and isolate them, and in fact there are not enough cells in the bone marrow. ما في كتير خلايا بالبون marrow. Why? Because they decrease with age. بس نكبر بالعمر all the stem cells decrease. And not only they decrease in number, but also they decrease in capacity. They are not as young as before. And this is, of course, published. However, the mesenchymal stem cell from adipose tissues are not affected by age. And we have done this study with Dr. Hassan El-Hashim, the effect of age and body mass index on the yield of stromal vascular fraction. And we have published it in Journal of Cosmetic Dermatology. And we have proven that the stem cell, in fact, are not affected by age. Because why? Because we said that the stem cell from bone marrow are able to mobilize. It means they are able to migrate, and therefore they migrate, they repair tissue, and then they decrease in number. However, in the fat, they do not mobilize. So they do not migrate from fat, and we can have a woman who is 45 years old, and she has a big number of stem cell, and one that is 27, and she has no stem cell. Why? Because if she has autoimmune diseases, if she is taking any immunosuppressant like colchicine, the colchicine will, where is the deposit? The reservoir of colchicine is in the fat, and it will kill all the stem cell. So for the plastic surgeons that are here, and when they do nano-fat, and sometimes the result are not as they expect, because maybe this woman or this patient has no stem cell or not enough stem cell in her fat. Then we have the adipose tissues. They are available. أكتر من liposuction ما في, non-invasible, safe, higher yield of cells, and they contain appropriate mesenchymal stem cell type for skin regeneration. Unfortunately, they secrete pro-inflammatory mediator. And they are affected by the person, okay? And as I said, sometimes no stem cell in the fat. So if the person has insulin resistance, then the secretome and the fat from this person, the exosome will carry the insulin resistance. So the exosome from fat will carry all the diseases of the adult person where we extract those fats. The umbilical cord. Low or zero immunogenicity. They are called universal donor. So why? Because first they are negative for HLA-DR, so they are not recognized by the immune system, and they have something very important that no other cell have. It is the suppressor gene, HLA-G. The suppressor gene will prevent the immune system to recognize them. And therefore, they are very specific. So we can give these cells from umbilical cord to everybody. Then slower senescence. You know, when we get older, we reach senescence, and our cells start secreting antibodies that are senescence antibody, and we start having cancer and Alzheimer. It's something very bad and very hard to accept. So those cells have slower senescence, so they don't age. Or if they age very slowly. Then they have greater anti-inflammatory effect. They are not influenced by diseases and donor because they are embryonic. They are formed in the embryos. So they don't have any diseases. And also there is no accumulation or mutation or damage compared to cells from other individual, so they are safe. And they secrete a great amount of proteins and exosome. So how do you obtain secretome? Before obtaining secretome, we should be capable of isolating stem cell. Because in order to extract secretome, أبها secretome لازم يكون في عندنا خلايا جذعية. طب كيف بده يكون عندنا خلايا جذعية؟ بيطلع لك هونيك واحد بيقول لك I can treat you with stem cell and I can isolate stem cell for you. No, you can't. And if you can, you have to prove scientifically that you are able to extract and isolate stem cell. And then we will believe you and we say, yes, you can give a therapy with stem cell. So if you have proven scientifically that you are capable of isolating stem cell, then you can give therapy with stem cell. And you have to follow the stem cell committee of the International Society for Cellular Therapy اللي حطت criteria to recognize and to identify stem cell. And in order to recognize and identify stem cell, they have first to adhere to the plastic. They should have in vitro the capacity to differentiate into adipocyte, into bone, and into chondrocyte. And if you cannot differentiate them in the lab in vitro to become bone and adipocyte, they are not stem cell. And they have to express certain marker, I'm not going to go into this, and they have to lack certain other marker. And this is in our lab. We have, this is our stem cell. They are adhered to the plastic, and also they have the fibroblastic morphology. Then this is adipose tissue, mesenchymal stem cell, and this is bone marrow, and this is adipose tissues. We are able to extract stem cell from all the sources. However, we decided that the best adult mesenchymal stem cell are the umbilical cord stem cell. So we were able to characterize them, and it took us 2 years, of course, and a lot of money also. So they are positive for CD105, CD73, and negative for other marker as per the criteria of cellular therapy. And here they are fibroblastic. As you can see, this is adipose, this is bone marrow, and this is umbilical. And also, we were able to differentiate them in the lab. So this is our adipose, bone marrow, and umbilical, and all were able to be adipocyte, fat, bone, and chondrocyte. And this is in vitro. And we have published in Q1 impact factor. You know, I don't have to tell you that there are Q1 impact factor and there are other journal that can accept any article. So we only published in Q1 high impact factor, and we proved that we were able to isolate stem cell internationally and recognize internationally that we are able to isolate stem cell. Now that we have proven that we are able to isolate stem cell, we can say that we can isolate secretome. And secretome or cell-free therapy that have all these characteristics. They are neuroprotection, they are immunomodulator, anti-fibrotic, antioxidant, chemoattractant, angiogenesis, anti-pain, etc. How do we do our extraction? So we bring umbilical cord, we cut it, and then we put it in a petri dish, in a flask, and then we collect. When they are explant, they release a lot of cells and a lot of proteins, and the density is very high. And this, when we collect those in the first passages, then they are full of protein and they are very effective. Then, after taking out the explant, we have our cells that will adhere, and when they become confluent, of course, I'm talking briefly, it's not only this. So when we have the cells that are extremely confluent, they start again secreting chemokines, cytokines, proteins, and also exosome and microvesicles. We purify them and we test them. We have a sterility test. We send them to the lab to be sure, even though we are working in a ISO 5 facility, however, we take them and we do a sterility test, and when we see that they are fine, we can say that we have collected our secretome. So, stem cell secretome again. So the stem cell secretome is formed of the soluble protein and the extracellular vesicles. The exosome. How the exosome are formed. So as you can see, we have the inwarding of the cell membrane. So the cell membrane will fold, and then we have the formation of the endosome. The endosome, then the proteins, the microRNA, and the RNA will come and invaginate the cell membrane of the endosome. Then the endosome, what happened? Of course, they are small molecular weight. Then what happened? The endosome will go and fuse with the cell membrane. And when they fuse with cell membrane, they secrete and they expel the exosome outside. And those exosomes will go and transmit what you say and what we call cell-to-cell communication. What do we mean by cell-to-cell communication? يعني مثل ساعة البريد. It goes and transmit information. They tell the cell, now you have to be transformed into, you have to have cell growth now. We have to have cell survival. Now you are going to work on the immune system. And also, they can communicate and transmit diseases. The sources of exosome everywhere, in the blood, in the milk, in the sweat, in urine, in placenta, etc. Again, the secretome. So the secretome, we are not going to discuss all factors and all cytokine because we will stay till tomorrow. What we are going to discuss only the cytokine and the proteins that are involved in skin rejuvenation and skin integrity. So we start by the anti-inflammatory cytokines. So how they work? They decrease natural killer cells. They decrease pro-inflammatory cytokines, and they increase anti-inflammatory cytokines. And this is how they are anti-inflammatory. The TGF-beta, if we are going to take the example that is secreted by secretome, it induces collagen, it works in wound healing, it contributes to the maintenance of skin structure and integrity. It is anti-inflammatory, it helps balance the immune system response to the skin, and also it helps in skin homeostasis. So this is TGF-beta. Then we have VEGF that increase blood flow and oxygenation and facilitate skin health and rejuvenation. We have human growth factors that help in wound healing and skin repair. FGF stimulate collagen synthesis, contributing to skin firmness and elasticity. All these are secreted by umbilical cord stem cell. Then interleukin-6, wound healing and regulation of skin homeostasis. Then the nuclear factor that protect the skin from oxidative stress and promote the skin overall health and resilience. Then we have, in addition, that is not present in the exosome but is present in the secretome, the tissue inhibitor metalloproteases, the tissue inhibitor metalloproteases that also contribute to the production of extracellular matrix, and also we have the collagen and hyaluronic acid that also contribute to the skin rejuvenation and regeneration. So, in summary, these growth factors influence various cells. They within the skin, of course. They contribute to collagen production, wound healing, angiogenesis, and maintaining skin integrity. They improve skin texture. They reduce sign of aging and support the overall skin health and rejuvenation. This is very important. How these growth factor or secretome act. When you say, when you treat your patient, you tell them we are using biostimulator. And we are using biostimulator in order to do what? To stimulate collagen. But how do we stimulate collagen? كيف عم يصير في stimulation للcollagen؟ طب هيدول الجروث factors يلي they are secreted. How they induce collagen? They have to bind to receptors. And those receptors, if you remember, we all studied this in biochemistry, the specificity. So if I have a growth factor from a human, then it has to bind to the complementary receptor in the human because they are specific. And this growth factor, for example, it's from animal or from plant. And it will not bind to the receptor on a human. They will not. And they will not induce the effect. وقت أنا بقول إنه this growth factor is going to act and it's going to stimulate collagen, or it's going to do wound healing, or it's going to repair the skin, it has to bind to the receptor. This is the mechanism of action. And the receptor has to be specific. It is going to be complementary. يعني إذا أنا جبت exosome للplant أصلاً ما عندهم growth factor، ما عندهم EGF. هلا حنعمل discussion. They will not bind. أو إذا جبت exosome من animal, okay, then also it will not bind. There is, maybe it will bind with less affinity, some of them, but specificity is the key. So they have to bind to this growth factor, to the receptor, in order to induce the effect. What they do, they stimulate the intracellular pathways in order to induce collagen, to increase the gene, in order to do wound healing, in order to increase the production of anti-inflammatory cytokines, or to secrete those apoptosis. And you remember in my talk first, I said that we have trophic effect, and the stem cells have trophic effect, and also they secrete bioactive factor. So we all have resident stem cell. كلياتنا عنا هلا stem cell. They are resident. So when these growth factor, not only they bind to the receptor on the cell membrane, but also they bind to the receptor on the resident stem cell. هيدول الخلية الجذعية عندهم receptor كمان للgrowth factors. So this growth factor will bind to the stem cell that are resident, and also those stem cells that are resident will secrete also bioactive factor. يعني صار عندنا دول effect. عندنا الجروث فاكتور اللي نحن حطيناه أول شيء من السكرتوم اللي نزل، بعدين إجا الجروث فاكتور على الريسبتور, and now it's going to bind to the resident stem cell, and the resident stem cell will be stimulated to secrete bioactive factor, and also it will stimulate the cell in the vicinity, trophic effect, to secrete also bioactive factor. صار في عنا a huge number of bioactive factor. And not only this, now the stem cell is activated. What it means, it can differentiate. So إذا أنا عندي scar بدي يتحول لكيراتينوسايت أو لسكين سيل, so I have to activate those resident stem cell, and this is how I get as if I am mimicking the effect of injecting stem cell. كأني أنا عم حط stem cell هلا مش growth factor. Why? Because depending also on the resident stem cell that I have. يمكن a younger person will have resident stem cell more than I have. So the more you have resident stem cell are looking for. And this is extremely important. And this is extremely important because we have to know what we are injecting and what we are using and how they will be activated and how they will induce their effect. Yes.
What about the synthetic exosome? Kitty plant, animal, human.
ما synthetic من شو؟ بدهم يكونوا تابعين شيء synthetic ها. by messenger or يعني by PCR. Then if they are PCR and they are human لازم يبلشوا من شيء, then yes, they will do the same effect. So the difference between the secretome or exosome from different sources, so we have the bone marrow, we said we have lower amount of growth factor, we have the adipose mesenchymal stem cell, they have higher amount of pro-inflammatory cytokine, and this is unfortunately, as we said, and may carry the person condition from, because we are taking adipose cells from a donor that is adult, then it will carry all the diseases and all the condition that the person have. And they may carry mutation. However, the umbilical cord stem cell, we said they do not have, it's from neonate and embryonic, so they don't carry mutation, they don't carry environmental factor. We have higher yield of stem cell, we have higher yield of protein related to skin, and they are able to migrate and have low immunogenicity. I'm not going to discuss this. Exosome from adipose tissue, it has been reported in the literature, لحتى ما خوفكم, it has been reported in the literature, and I have of course the references that are in the slide. قطعت عنها بسرعة. Let me see if I can go back. So these are all the literature review on that exosome from adipose tissue. It's in the literature. ما ألفتها أنا. They might and they may cause cancer and melanoma, which is not the case for umbilical cord stem cell. So why umbilical cord secretome? You are going to tell me that there is a lot in the literature about exosome, more exosome than, it's like everything, it's commercial. We want to buy, to sell. right? But however, why secretome? We said why umbilical cord. خلصنا منها. So now we are going to talk about why the secretome, not the exosome. Because the secretome, as I have said, they have all the secretion, we have all the cytokines that are present, because we have the protein that are present, they have the exosome inside, and they have the microvesicle inside. So we take the whole. And as I said also, that's why I started by introducing stem cell, because we are mimicking. We talked about the environment, and we said it is the environment who dictate the fate of a cell. So now we are injecting, or we are using the whole environment of stem cell. Therefore, we are mimicking as if we are injecting stem cell, as if. And that's why we use secretome, not exosome, but we can extract exosome if you want. But we believe in the whole. So now, secretome, I'm not going to repeat, it's a repetition. Now, if we have umbilical cord, and we're not now comparing between other, if we have secretome and exosome from the same source, umbilical cord, the secretome of umbilical cord contain higher protein concentration, higher number, more amount of growth factor, specifically skin-related protein. I'm not going to talk about them all, and then we go into now the plant stem cell. So now we hear a lot about stem cell. So the stem cell of the plant are called meristem. اسمهم meristem. And they are found in the area of plant that are continuously growing. They are found in the root and shoot of the plant. And they differentiate into a plant part. They don't differentiate into skin. They don't differentiate into hair. They differentiate into skin part. So they differentiate into phloem and xylem. They differentiate into palisade. They differentiate into hair root. And do plant stem cells secrete growth factors? No. They do not secrete EGF. They will not secrete FGF. They will not secrete TGF beta ما عندهم. Why they need this? They have other growth factors, and they have other proteins, and this is the phytohormone, sorry. And this is the phytohormone, oops. And this is the phytohormone that is, so they have their own hormone, the phytohormone, their own protein, auxin, cytokinin, peptide hormone, polyamine. You are going to ask me, but we have medicinal plant, and some plant are anti-inflammatory. Yes, true. Yes. But what is the mechanism of action? No known mechanism of action in human cells at all. No complementary receptors. They don't have complementary receptors. They have, yes, indirect effect. But this indirect effect, if it happens, it is less potent and less efficacious. Why? Because we said why. About the receptors and the stem cell and etc. The activation. So the plant action, you are going to tell me, they have, yes, we have antioxidant property for some stem cell, like polyphenol, because it's present in the fruit, and the tea, and coffee, flavonoid, carotenoid, the precursor of vitamin A, and yes, they have oxidative action, and they suppress inflammation, but by indirect mechanism. They act on the signaling pathway, the NF-kappa B, and they decrease the NF-kappa B, so they have the anti-inflammatory effect. You are going to tell me there is the curcumin from turmeric, and we have the resveratrol that is present also in our cream, and we have the quercetin from fruit. Yes, they have anti-inflammatory effect, and they will bind to cyclooxygenases, inhibiting cyclooxygenases, and inhibiting also the prostaglandin. And this is how we have the effect of plant. But however, if exosomes are extracted from these plants, then they might be active as anti-inflammatory oxidant, but with reduced activity. So it's up to you. I have to ask you a question. If a patient comes with rheumatoid arthritis, do you prescribe them non-steroidal anti-inflammatory drug or DMARD, or you tell them to go and take curcumin? So if you have a scar and you have a skin injury, well, it's up to you to decide what to use. Done. In summary, our secretome from umbilical cord are superior. They contain all needed molecules for therapeutic action. They contain protein, collagen, fibronectin, growth factor, not present in exosome. They are more potent, more efficacious as an anti-aging molecule. They are safe, no risk for tumor, high efficacy, and more potency. These are the three umbilical cord mesenchymal stem cell secretome by Stemica, skin rejuvenator, the plumber, and the hair follicle stimulator. Then we have no adverse effect. We used to use penicillin, and penicillin used to have people who are allergic to penicillin used to have allergy. Now, not anymore. We are taking out penicillin from our secretome, and then the secretome is used as anti-aging, skin rejuvenation, dermal thickness, tightening, reduced wrinkle, all these anti-inflammatory, skin injury, regeneration, and Dr. Hussein Abu Khalil and Dr. Hashim will discuss clinically. So maybe we have a way for you to live young forever. So Stemica, and yes, we are Lebanese, and it is a product of Lebanon, and I don't think plastic surgeon who come from the US is brighter than you, and a dermatologist that is Korean is brighter than you, and I don't believe any other person from other country is brighter than us. So I think as a scientist, and I think, yes, we are proud to be Lebanese. Thank you.